afternoon. Happy Wednesday. I love seeing all the faces popping up. Some of these faces I've seen this week. So you've joined us before. So welcome to our program today. We're going to be talking about chasing wind. Some of you might know what that means and some of you might not. So we're going to dive into that. So I'll give you all a minute just to get connected. And while you do, I will introduce myself. I'm Anissa Mitchell with PMD Alliance, and today we have with us Dr. Robert Bibeau. He has been with us before, so we brought him back to continue the conversation. He is a Doctor of Oriental Medicine, and he has spoken, like I said before, in online and in person. He is a former Marine Corps captain and infantry officer. He was deployed to Iraq and he was wounded in action in 2008. And after his honorable discharge and many commendations and medals, including the Purple Heart and the Global War of Terrorism Service Medal, he returned home to New Mexico. He's in the Albuquerque area with his family, and he is now a board certified and licensed Doctor of Oriental Medicine, and currently is completing, unless you've completed it since I got this updated, your Doctorate of Acupuncture in Chinese Medicine. And he and his wife, Tiffany, are owners of Mountain Path Acupuncture in Chinese Medicine. So welcome, Dr. Bibeau.
Thank you.
And I'm really sure you can fill some gaps there of things that I didn't cover.
I mean, I think we hit the headlines anyway, so we can, kind of get to kind of the cool stuff of what everybody's here for, rather than just, kind of my resume. But thank you for sharing it. Thank you for such a great introduction. And I'm really, it's great. I kind of toured through to see, who all is on with us, and there's some familiar faces. So, looking forward to talking to you guys again and questions that you might have, and just kind of being able to share some time with you.
Awesome. Well, speaking of questions, I encourage everyone to open up that chat box so that you can drop those questions in. And today is conversational style. We don't have any slides. We're going to be talking, and that means we want you to be engaged, and feel free to ask your questions. And as we're having the conversation today, we're going to bring those into the discussion. So I'll kick off, first of all, to just see if there's any more of your story that you would like to share and how you ended up in Eastern medicine.
Yeah. So after, that's a good question. After I got wounded, I went to the Marine Corps Wounded Warrior Battalion at Camp Pendleton. They have a whole Wounded Warrior regiment, and there's two battalions, one on the East Coast, one on the West Coast. So I was at the Battalion West, which is on the West Coast at Camp Pendleton. And while I was there, so after I got hurt, I medevaced home, I got put on this cocktail of like, I think 22 different medications, something like that. It was a lot. And, during that time, I couldn't run, I couldn't swim, I couldn't lift, I couldn't do any of the things that really kind of like are part of who you are as a Marine Corps infantry officer. It really is, I mean, just as a Marine, really, right? And it was very, it's kind of devastating, right? Because it takes this piece of you, and it's like, you don't get to be you anymore. You don't get to do this stuff. And then like with the medications, you start to put on all kinds of weight and things like that. So, it's pretty distressing, right? And I ended up as an alternative therapy pursuing a really robust study of Chinese Kung Fu, which is a martial art. And the corollary to Kung Fu is what's called Qigong. So like Tai Chi, it's a type of example that's maybe a little more familiar. And so I've studied really in depth both Kung Fu and Qigong, and that introduced me to the not just the principles of Chinese medicine, but even sort of the culture that surrounds it. I started getting acupuncture periodically for some of the host of ailments that came with everything that I was suffering from, both as a result of my medications as well as my injuries. And it started to help me get my life back, right? And so when I got out of the Marine Corps in 2013, I opened a Kung Fu school. And, you know, it was fascinating because within weeks of opening the school, I identified, because we started to get students fairly quickly, which was, you know, I mean, as a new business site, that's lucky. But within weeks of opening the school, I identified that all of my students were more like patients. Every single one of them was recovering from some sort of something, right? Sometimes it was like, I mean, one instance was a dog bite, another was a skiing accident. I had several instances of people who had come to me because a boyfriend had beat them up and they had, you know, trauma from that, but also, you know, like physical trauma, but also like severe PTSD. And so there's these things that were present where it was like, man, the highest levels of kung fu are medicine, specifically Chinese medicine. And if I really wanted to do justice to the community I was trying to serve, I needed to go back to school. And so, fortunately, there's a school here in New Mexico. It's actually closing in August after I think 42 years of being open or something like that. But it's Southwest Acupuncture and is in Santa Fe. So for 3 years I treated school like my job, and I would commute every single day to Santa Fe. It's about 50 miles away, and just studied like crazy. And I would come home at night and teach kung fu and get up about 3 or 4 in the morning and do it again. And so that's basically the wave tops of how I got into Chinese medicine, and I'm glad I did. So if it hadn't been for somebody putting a bomb in the desert that I hit, I wouldn't be doing any of the stuff I'm doing now.
Well, I appreciate that bit of background, because I think that I've seen a few heads kind of shaking because you talked about, just not being able to do the things you were, and how your lifestyle was changed because of your injuries, and, just looking to supplement the care that you were getting with traditional medicine, or the medicine that we know as Western medicine, with medications, but things that can't always be treated with medications, or, contending with side effects of medications. So that's, I think, something that all of us can relate to in some form. So
it's a super common thread, right? Like,
yeah.
This idea that you had something that you were pursuing, right? Your goals in this life, and all of a sudden they are taken from you, right? And you have to try to find a new way forward. I do think that this is part of what makes me, I feel like I'm a pretty good doctor. And I think part of what makes me so is that I've lived this. I've had this thing taken from me. And I mean, my life's dream was to be a Marine Corps infantry officer. And here I was living that. And somebody took that from me, right? And with something like disease, a state of disease, it's like, it's often not someone that did this thing, right? It's just cards you're dealt, right? But it's like, still the things that you were pursuing, and all of a sudden you got to try to find a different way. That's hard. That's really hard.
So I'd like it if you could get into a little bit about what the title of this topic is: chasing wins. So yeah. That's a foreign concept to most of us who are really using allopathic medicine traditionally. So can you explain the difference approach in Eastern versus Western medicine? A little bit, but maybe dive into a little bit more.
It's a long answer. Probably about 5,000 years
version.
History, but I'll try. So one thing that's fascinating about Chinese medicine is that from antiquity on, it's been passed on and taught and described in a manner that the layperson ought to be able to understand, right? And this is something that's sort of anathema to what we find in conventional care or allopathic medicine, Western medicine, where things are said to you in Latin or Greek, right? And so you're supposed to try to parse out what that means, right? Well, when you hear a phrase like wind in Chinese medicine, and you understand that within that culture, the idea is it's describing a phenomenon that you can observe in your day-to-day life, in your day-to-day routine. And all Chinese medicine is described in these kinds of terms, right? So the idea, but it's described for a culture that has a completely different mindset than we do, right? A different way of viewing the entire world. But once we start to kind of wrap our mind around, hey, look, this is not like some sort of folksy thing that they're doing here. Like they're not saying it in some sort of, you know, nearly poetic way. They're not describing a diagnosis in this almost poetic manner simply because it's folksy or folk medicine or it's antiquated or it's, you know, not valid. They're doing it so that the layperson can understand it. And so this idea of wind, right? Like tics and tremors in Chinese medicine. My Chinese would be terrible, but I think it's chuanjiang is like basically how you say this idea in Chinese medicine. And these sorts of things, they're described the way that James Parkinson described it. He calls it the shaking disorder, right? Initially, when he writes his initial paper, he calls it the shaking disorder, right? And it's fascinating because like this guy, you know, in the 1800s, he's got like guys like Tourette are like students of his, right? So like Tourette's syndrome, like as we understand, right? Well, Tourette was like this student of Parkinson, and Parkinson, he takes actually this nearly same approach of describing the shaking disorder, as he called it, in a way that we can all observe and understand. So if you have this idea of wind, right? Like New Mexico right now, springtime, if you're here, you know that it's wind. I'm looking out my window right now and I'm seeing the trees shake. They're shaking with the wind as it passes. And this is a phenomena that we can all observe. We all understand this the second that we see it. So the second we hear it, we understand this as well, right? And it's like, well, wait a minute. What about rigidity? That's not a word. Rigidity. I promise I'm a good doctor and I know words. So this idea of rigidity, right? Well, that's not wind. Well, in a really strong gust of wind, does that tree not just stay bent? Does it not stay in that rigid structure, you know, flowing with the wind? It does, right? So the shake or the rigidity, or even like a thing trying to push against the wind, right? That too is that idea of rigidity. And so these terms that they use diagnostically in Chinese medicine, they are designed so that the layperson can understand it. And once we get past this notion of like, well, that makes it not valid. Like, no. It makes it all the more valid because you can understand it because I didn't say it in Latin. Does that make sense? Is that a
Makes a lot of sense. And I mean, of course, I've heard the description of tremor as wind, but when you just described the rigidity, that made a lot of sense to me as well. So, because not everybody has a tremor that has Parkinson's, but a lot of people experience problems with rigidity, and some people that's their, you know, one of their main symptoms. So to hear it described in that manner is really helpful. I wondered if you could go through some of the other or of the 5 elements that is used in diagnosing and treating in Chinese medicine, and maybe how those might be seen in Parkinson's?
Yes, but let's come back to it because as you were describing that, it started to bring up something that's really, really fascinating. Because this idea that everybody who has Parkinson's is going to have like the same symptoms. It's like we know that is for sure not true. And in the diagnostics of Chinese medicine, the devil is in the details, right? There's as a foundational understanding of the medicine, we have the idea one disease, many symptoms, and one symptom, many diseases, right? And sometimes they'll use the word patterns instead. So like many patterns, one pattern, many symptoms, one symptom, many patterns, because we usually talk about a diagnosis or a disease as like a pattern of what we call disharmony. And so in something like Parkinson's, so there are at least 9 variations in Chinese medicine on what would have a corollary diagnosis in Western medicine of Parkinson's. 9, right? So we have 9 diagnoses that are like, okay, that's Parkinson's. And each of those diagnoses, like, so for example, what we would call liver yang rising due to liver and kidney yin deficiency, that would manifest as Parkinson's many times. Other times it will manifest simply as something like migraine headache, right? And it's like, well, you know, those are way different, obviously. But if you have Parkinson's, so let's just focus on the Parkinson's aspect. If we had liver yang rising due to liver kidney yin deficiency, or maybe it was just tremor due to liver kidney insufficiency. So you take the liver yang rising portion out. That will manifest differently than Parkinson's due to what we would call liver blood deficiency. So liver blood deficiency will have as a diagnostic criteria rigidity, whereas liver kidney insufficiency will not have rigidity, but it will always have tremor. So this sort of thing here, it's like it changes the dynamic pretty significantly. Both are Parkinson's, but we would treat both of them wildly differently, right? Because there's different things that you need to try to do to correct those things. So, and this also is where some of the brilliance of Chinese medicine is like, okay, if you got the right diagnosis of liver kidney insufficiency, all you have to do is tonify the yin of both the liver and the kidney. Easy, right? Easy treatment predicated on the diagnosis. Now I use the word easy, and it's like, well, that, how easy is it really, right? Again, devil's in the details, right? You have your work cut out for you. There's no doubt about it. The way that the 5 elements plays into this is that it's an old model that is used, right? It's relevant. And when we say elements, it's not a great translation, right? Because to our Western minds, we hear element and we think building blocks. The 5 elements in Chinese culture and medicine would be better understood as categories, 5 categories. And the model of those 5 categories is really partially about what fits in what category. And everything in the universe fits into one of these 5 categories. So that's one aspect, is everything gets categorized somewhere. Ancillary to that is what generates what and what controls what. And so in a healthy relationship in the 5 elements, wood generates fire, and fire generates earth, and earth generates metal, and metal generates water. And then we're back at water generating wood. But wood also controls earth. And this is kind of a fascinating idea, right? Because here we are defining these relationships between all phenomena in the universe. Like, well, how does wood control earth? This is kind of a foreign concept to us now because we don't see it very often. But after a forest fire goes through, and let's say, so you had wood, it got burnt up in the fire because wood generates fire, and fire generates earth. That's the ash that's been made. But that controlling relationship of wood controlling earth now becomes important, because what happens after a forest fire, the next time the rains come along, all the soil gets washed away, right? You have these landslides because the earth that was controlled by the wood, it was controlled by that root structure that had existed, right? So, and that's just one example, right? Like, I mean, we could look at the way that fire controls metal, and it's like, well, fire melts metal. So here we have these sort of like ancient, very interpretable explanations of the relationship phenomena of everything in the universe. And it's a worldview that helps you kind of parse out like where a thing fits diagnostically. So the liver fits into the wood category or the wood element. All of the things that are associated with the wood element, like your eyes, for example, like the eyes are considered associated with the liver. And this ends up being, like if you see like an alcoholic, what's a crystal clear sign of an alcoholic, right? Or therefore liver disease, right? So liver disease would be a sign of alcoholism. And what will you see in the eyes in like severe cases of it? Well, jaundice, right? It's like the first place you see it before you see it in the skin. So it's like, okay, so here's a corollary where Western medicine and Chinese medicine marry up really, really brilliantly. But I'll bet, and just put your hand up in the audience up there if you see like little floaters in your vision, or if you have chronically blurry vision. If you're a Parkinson sufferer and you see like these little floaters, little specks in your vision, right? Or you have super blurry vision. Yeah, lots of hands going up, right? So this would be a diagnostic identifier within Chinese medicine of a liver disharmony. Doesn't necessarily mean you have Parkinson's, but if you have Parkinson's, you probably have floaters in your vision. And some would be like, well, Rob, that's kind of lowballing it here, because like lots of people have that and they don't have Parkinson's. Yeah, one symptom, many diseases. One disease, many symptoms, right? So that's like that foundational pillar in understanding of medicine. So when we look at the 5 elements, it's critical to being able to understand and comprehend the medicine, but also it's a great way to just kind of view the universe at large. The Taoists have this great phrase, why should I travel the world when I can know the whole universe by looking out my window? And it's this idea of the 5 elements that kind of helps you interpret these things. The other level that you kind of have to have at least some grasp of is like, what is chi? Because all those phenomena in the universe that fit into those 5 categories are chi. And we think of chi, like the example I always use is like your Yoda lifting an X-Wing out of the swamp. And it's like, because chi is energy, right? Well, I mean, maybe, right? Like chi is, energy is one aspect of chi, but chi would be better defined as matter with yin and yang. We don't say yin and yang or yin and yang, it's yin and yang. Yin and yang define the state of that matter relative to other states of matter. And so chi in an extraordinarily yang state would be, energy, or what we would conceive of as energy. And chi in an extraordinarily yin state would be like a solid that we would interpret as matter, or even like a liquid could be considered yin. This gets like really dicey, and I could probably fill the whole hour just talking about these. So, but our interpretations of them in the West, I think, have been flawed for over 100 years because of a poor translation of a word that translates better as an idea than it does as a word or a phrase. I hope that answered the question.
You did, and you just really explained. Well, it's first of all, it's simple and complex at the same time, right, and it's very interconnected. So, and I think that's a crucial point, right? Like in Chinese medicine, we don't necessarily separate out the person from the disease state. Like everything is so interconnected.
We don't separate it at all.
Yeah.
At all. And your comment of like, it's all interconnected. One of the foundational texts I don't want to say foundational. One of the best books on trying to help get these ideas across to the Western mind and the Western layperson. It's the book that I recommend to my peers in the conventional care paradigm. So particularly MDs and DOs. And once they start to read it, they're like, oh my God, Rob, this book is incredible. And that's how I feel about it. But it's titled The Web That Has No Weaver by a guy named Ted Kapchick. And this book, it's fascinating. I mean, like, honestly, like there's times I'll go back to, actually, I just got chills just thinking about that book right now, because the title, The Web That Has No Weaver, right? Ted is talking about, I guess I should call him Dr. Kapchick, right? But like he's talking about the interconnectivity of everything that is you as well as the universe surrounding you. It's fast. I mean, like think about what disease does to your whole family, right? You've got the thing, but your whole family is trying to deal with that. Are there not connections there? There are. Absolutely, there are, right? So, I mean, the interconnectivity of this is profound. And so this idea of you as a web that had no weaver, it's just there, right? That's fascinating. That's one of the things in Chinese medicine, like we don't really care why a thing works. And Ted Kapchick talks about this in his book. We don't care why a thing works in Chinese medicine or culture. We just care that it does, right? The idea that the thing worked is enough, right? And in the West, we're like, hold on, right? Like, I want to see why this did this. And so, I mean, honestly, the integration of the two medical models is very much the integration. We're watching it right now. Like we're seeing the whole world pioneer the integration of these two medical paradigms. And it's the idea that like we can be satisfied with a thing working just because it does, but still like take it apart and take a look and see why it does it. It's pretty cool.
Well, and I think that, like you experienced, for a lot of people, regardless of what medical issue they're contending with, Western medicine does a lot, but there are pieces of it that can be filled, or gaps that can be filled by Eastern medicine. And we are definitely doing better, I think, in being willing to integrate and to look at both approaches at that whole person. And that's what I love about the things that you're talking about, is that we do look at the whole interconnectivity of the whole person and the systems within their life. The family, as you said, it's not just one person that's impacted, it's a whole family. I would love it. Yeah.
Oh,
go ahead. I'm sorry.
So this idea of the Western paradigm. So first of all, like Western medicine, there's too many people who are picking up their battle axe to kind of like parse out like which side is better, and it's like, hold on, man. Like when it comes, like listen, like the example everybody always goes to is like, well, if you have a gunshot wound, you want to get Western medical care. It's like, yeah, no kidding. If you need to have an organ removed, like, yeah, which also hilarious, right? Because sometimes I meet like my MD peers and they make fun of me and they're like, hey, Rob, still taking all that blood out of your patients, which I'm not. But I'll be like, hey, Todd, you still taking all those organs out of your patients, which they are. And I think that's hilarious. But also sometimes like you got to take the thing out, right? And I'm not going to do that, right? I don't want you coming over here and be like, Rob, use your needles and take out my gallbladder. Like, how about we just try to dissolve the stones, my man? Western medicine has its place, and Parkinson's is maybe the best example of this because, first of all, Parkinson's is extraordinarily well researched, right? Arguably, maybe the most well researched disease state at all, maybe besides cancer, maybe, right? And yet here we are finding that we know frighteningly little about the disease. We know so much about it, and we know frighteningly little. But then it gets more complex than this because like with Parkinson's, carbidopa, levodopa, 100% still sort of the pinnacle of care, right? Yet within 5 years, 50% of patients have developed a tolerance to the drug, and it's less and less and less effective as they move forward. And it seems to be that within 5 years of that, the remaining 50% of the remaining 50% also have a tolerance, right? So it's like, how do we stave that off? Where do we marry this up? Acupuncture is fantastic at it because it absolutely helps balance the dopamine and acetylcholine imbalances. I don't want to say we know for sure, but it definitely looks like that's what's happening. It's pretty fantastic. And you can utilize acupuncture, have a smaller dosage of your levodopa, your carbidopa levodopa, and seems to be the case that it prolongs the amount of time before the drug is taken before you've developed that tolerance. So this is really fascinating. It's worth exploring at minimum. So this idea of like conventional care and the historical medicines, right? I don't know that I like the term traditional medicine, but like these historic traditions that are medical traditions, they do marry up. And there are a lot of places where a thing is subclinical by that conventional care paradigm, and Chinese medicine has an answer for it. Because that same idea of liver blood deficiency, right? Like cramping in the calves. I'll bet a number of people in the audience today, before they started developing their tremor or their rigidity, had cramping in their calves. I bet it was one of the very first symptoms that they had. And in Chinese medicine, it's like, oh, well, that's liver blood deficiency, and we could treat it early, right? We could get ahead of it, and maybe you develop Parkinson's, maybe you don't. So it's a fascinating thing because those gaps where it's a subclinical thing, and a Western physician will look at it and say, oh my God, I think I know where this is going, but I can't even say it, right? Can't even look at where this might be going because I can't measure it yet. And that's got to be frustrating, right? As a conventional care physician, where it's like you could see the storm coming, but there's nothing you could do. Well, send them to an acupuncturist, because not a charlatan. Find an actual acupuncturist. Find somebody who knows what they're doing and is a scientist, not a wizard. But there's a good chance that when those things are subclinical, we could get ahead of them.
So that's really a good point. So, as people's disease progresses, obviously the need for more medications, as you mentioned, is obvious. And with that, the potential for the side effects such as dyskinesia and all of that. And so there's definitely a place for that. And there's definitely a place for Chinese medicine. And there's some things that the medications don't treat. So that's where, even the work that you're doing can add to and or treat those things that are not. And I would love to delve into some of those things. And I know one person had asked a question because, it doesn't cover everything. And, some symptoms are part of the disease, but taking a medication doesn't necessarily help it. And they were saying that they were having vision issues. Their vision was was not as clear as it had been. They had asked their physician about it being caused by Parkinson's, and
Oh yeah.
that
So
does happen. So,
yeah,
you know,
is that Gerald's question?
yes, Gerald is
Yeah.
the one that asked
So
that
okay.
question.
So to the Western physician mind and the way they view the body, the way they interpret it, and it's like you got to kind of be careful when you start saying this thing, because it's like wait a minute, man, the body is the body, and these systems are these systems, and they don't differentiate this way. And it's like, yeah, to your worldview, right? But like, so going back to the five elements for a moment, right? Like the idea of the element fire, it's associated with a direction, as is the element water. The element water is associated with north. It's also associated with cold, right? The element fire is associated with heat, and it's associated with south. Well, why would that be, right? This is just an example of like how worldviews are shaped, right? Here in the West, we view north as up, right? But in China, particularly in antiquity, I mean, I don't want to presume that this is how China sees the world today, but in antiquity, south was viewed as up, right? The sun rises in the east, sets in the west, but it is in the southern hemisphere. And north of China is a whole bunch of cold, like tundra and stuff, right? So you're kind of like here, right? You got Canada up there, which I've never been, but I understand it's pretty cold. This idea of like north being associated with down because it's associated with cold. This is just an example of like how worldviews are completely different. Completely, the way you interpret everything around you shapes your whole reality. And so this idea of your vision not being associated with your Parkinson's, to a Western physician where they parse out these systems of the body, yeah, not related at all, not even close. But to the Chinese physician, right, 100%, right, 100% they are connected, and it's probably because Gerald, I'm guessing, Gerald, I don't want to diagnose without actually treating you or anything like that. But if I was to venture a guess, I would guess that you probably deal a lot more with the sort of rigidity and dyskinesia rather than tremor. I may be wrong here because I'm going off of just one symptom, but to the Chinese doctor or the doctor of Oriental Medicine, yeah, your vision disturbances are 100% related to your Parkinson's. More
Well,
appropriately,
you know that there are vision disturbances in Parkinson's. So it just, how just goes to show like it really is a team approach. And there are, neuro doctors that specialize, and neuro-ophthalmologists is what I'm trying to say, that specialize in vision problems. So, and that is an important part of, just looking at the whole person. Now, there's been some other questions about whether acupuncture can address things like the gut biome, because we talk a lot about the gut being a part of Parkinson's, and whether it starts there or brain first and travels.
So first of all, yes, it seems crystal clear that acupuncture, Chinese medicine at large, but acupuncture as a portion of that, it seems crystal clear that the Chinese medical model or paradigm absolutely addresses the gut microbiome. Actually, there's a great doctor. He's a friend of mine, and he's such a good friend that all of a sudden I'm forgetting his last name. Dr. Andy. Oh my God, he's probably watching, and he's like, Rob, come on, get the name. It'll come to me in a second. But there's some guys out there that are really pioneering that kind of stuff and looking at it in a combination of the Chinese model and the and the Western medical model. But the answer to that would be yes.
So this is something I think a lot of people are interested in, because there's just things that are really difficult to treat, such as pain, the GI issues that can happen, sleep issues, anxiety. Can you talk a little bit about how you would approach some of those things? And is that something that Chinese medicine is good at? And is it just acupuncture, or do you couple that with other things
Oh
like supplements?
man. So let's start with the idea of, man, so many places we could start on that actually. So the idea of is it just acupuncture? Um, no, and it definitely should not just be just acupuncture. Patient outcomes are significantly higher when I integrate Chinese medical herbs, acupuncture, and practices like Qigong. And this is for every disease pathology, right? Everything that I treat, uh, patient outcomes are higher when we integrate all three. When you integrate them with conventional care, patient outcomes go even higher. Yeah, there's this fascinating research. I'd have to go back and find this article. Um, it's available on PubMed if you were to go try to search it yourself. But it basically identified that um, acupuncture, standalone acupuncture, when done routinely, regularly, was as effective at reducing hypertension as antihypertensive medications. This is fascinating because it's like, hold on, that shouldn't be the case at all, but it turns out it is. Now, if you stop doing your acupuncture routinely, it is generally somewhere around like once a week, maybe once every 2 weeks, once you get well managed, that gets expensive, right? That's hard for patients to manage. And so, yeah, but it appears that regular acupuncture is as effective as pharmaceuticals in reducing hypertension. So this is really, really incredible. But when you integrate the two, which becomes vastly more affordable, right? So I am not by any stretch saying like, stop your antihypertensives, right? No, I'm not saying that, right? Because your risk of like stroke or heart attack goes up pretty significantly if you're like, I'm not going to take these drugs anymore. But your ability to manage them on smaller doses of medications goes up significantly, right? To like the 90-somethingth percentile. It's incredible. So when you integrate these care models, herbs, acupuncture, Qigong in particular, and conventional care, patient outcomes much, much higher. So managing cost ends up becoming the next actual right sort of piece of the puzzle there. Now there ends up being a place where you kind of get a little bit hamstrung, right? So like there's an insurance company that I'm contracted with now who absolutely will not permit at all any prescription of herbal medicines. And so it's like here I've got these patients coming to me who I know for sure the herbs would help, and it would reduce the cost of the insurance company, it would reduce the cost of the patient, it would improve their health long term, and yet can't do it. So one of the brilliant aspects of Chinese medicine is that, so there's 8 branches of Chinese medicine. Herbs is a branch, acupuncture is a branch, Qigong is a branch, meditation is a branch, nutrition is a branch, right? These 8 branches of Chinese medicine, the idea would be that you could implement just one and still have positive health outcomes. So we could do just the acupuncture and get benefit. Does that make sense?
Yes.
Okay.
And there's some people that might just do the nutrition or the qigong or anything like that. I mean, do you have people that choose not to do the acupuncture but benefit from other branches?
Yeah, absolutely. So I have patients that come in and they're like, Rob, like, I'm sure you're a great acupuncturist, but I have a, absolutely, fundamental inherent terror of needles, and you're not putting a needle in my skin. Like, get away from my body with your needle. And it's like, okay, fine. Right. We could do massage. We could do non-insertive therapies like, so there are other implements that we can use. So I've got this patient, young kid, not a Parkinson's presentation. It's actually known as Hirschsprung's disease. And I've never put a needle in this kid, not even once. I just use these tiny little, they're called a migraine pellet. It's basically like a gold-plated BB that's tiny. Put that on the acupuncture points, send them home. And, this kid's been doing really, really well with just that. I have patients that come in just for Qigong, and they're doing really well. And what's fascinating, what's been really great is as I continue to work with these patients, their level of trust in what I'm doing is gone up significantly, where it's like, hey, Rob, I said never a needle, but I'm really suffering here. And I wonder, like, would an acupuncture needle maybe be the thing to do? And if it is, then it's like, yeah, we do that. And so I mean, that's just an example of like being able to develop and foster trust between the physician and the patient, right? So.
Yeah. Well, and some of those symptoms I mentioned earlier, there's not always a good medication for that. So there's, other things people try, like if they're having sleep issues or anxiety, yes, you can take medication, but it doesn't always work or might have side effects. But, people have, tried yoga and meditation, things like that. Those are easy things to adopt, but something like Qigong or which I'd love you to explain a little bit more to people about what that is and what it does, and acupuncture. Those are things that can help with certain symptoms like sleep issues.
For sure. So, okay. First, let's just look at, because like you mentioned the yoga, right? So let's just start with whether or not it's effective. And the answer becomes yes. Any exercise really becomes effective, particularly in something like Parkinson's. There's a great study. It was, I think it's a 2018 study. Hang on, I bet I have it. This is really, really cool. A study by two authors, Ellis and Rochester, is 2018. You can also find this one on PubMed if anybody wanted to go into it and check it out. But like basically the idea of, is exercise effective in the treatment of Parkinson's? And it's like, oh yeah, crystal clear. It absolutely is. Well, why? Okay, well, exercise releases dopamine, right? So we know that. And the reduction of dopamine uptake, factors for one aspect of the disease, and the increase in acetylcholine basically is the other aspect, right? And so you regulate these neurotransmitters much more effectively through exercise. And then you have the question of dosing, right? Because it's like on your carbidopa levodopa, it's like, okay, you have a certain dosage that you take, and it's specific for you. Marlo had a question of like, how often should you? What is regular acupuncture? And it's like, it depends, right? Your frequency of acupuncture could be considered the dose, and it is predicated on you and what is going on for you. Well, the same would be true of your exercise. How do you dose exercise? And something like Qigong or Tai Chi or even Kung Fu, the dose would actually be, it's like the Chinese like figured this out like a couple thousand years ago. You do the traditional form, right? Like the set of movements that is specific to that Tai Chi or that Qigong or that Kung Fu set. And that's the dose. And if you're ready for a more intense dose, you go harder or you add another form. But you could do just the one form, and that can be your dose. So it's easy to with the use of Qigong or Tai Chi, sort of titrate the dosage that you're receiving, right? So this is really fascinating. And you could do that with other forms of exercise as well, right? Like let's say you're a runner and you're like, I'm gonna go run. First of all, it's like, why do people get a runner's high? Well, it's probably the dopamine, as well as various other neurotransmitters and hormones that are released during the exercise. But you can see that people take it way too far, and it's easy to do that. It's easy to overdose on your Tai Chi players have a phrase called chi sickness, right? You'll see this out there. Usually it manifests as what we would call like a Shin disturbance, or like sort of psycho-emotional type things. So you can overdo it, right? It takes a lot to overdo, but it can be done. So that's one of the brilliant aspects of Tai Chi and Qigong as a practice, is that you're able to dose how much exercise you're getting. And it's a social activity, right? Yoga is as well, right? If you go and you do these activities, it's like, man, you're getting around people who are dealing with the same kind of stuff. You're able to like, talk about your grandkids and their kids and all that stuff. The practice itself of Qigong, because that was kind of your question, the practice itself of Qigong it's very much a breathing and movement paradigm, right? So it partners movement with your breath for a specific set of movements and a specific set of time. So, hopefully that answers the question.
And we've had a couple of other questions about some other therapy, like tapping.
Yeah. So it's not uncommon. So I generally would say things like tapping or like cupping or things like this, things that have become very in vogue, right? It's like, is there good evidence for its use, right? And the answer becomes yes. And anytime there's a thing where there's good evidence for its use, and that evidence is not particularly well understood by practitioners, it ends up being an excellent spot for charlatans to step in and ride the coattails of some practice that is effective. And you want to watch for that. So my short answer to what about tapping would be, yes, tapping works, but why are you doing it? And it would depend on where you're tapping and things like this, right? Like, it's not uncommon. I had a professor who he would talk about, like, when he lived in China, he would see people kind of tapping on their chest all the time. And there's this belief that this helps you avoid various endocrine disorders, which would often sort of present in Chinese medicine along. It would actually often come up also as like a wind disorder or a tremor disorder, but it would be like thyrotoxicity, right? So like if you look at like alcoholism tremors or thyrotoxicity or something like that, like a thyroid storm, like the tremor that's there is very different from the Parkinson's tremor or like a restless leg sort of tremor or something like this. The movement is different. It's just a different tremor, right? Mm-hmm. But these sort of thyroid disorders, that would be like an example of where tapping may be effective. There seems to be some evidence that for like what we would call shin disturbances and shin disorders, tapping can also be effective. So I guess my answer on tapping would be, it depends on who you're going to, why, what their background is, and so what their knowledge base is, what their certifications are. So short answer, yes, tapping works. Long answer is it right for you? And how would you integrate it with other therapies that are appropriate?
Right. And I think that is key, is that, having that holistic approach. And, some people, like you mentioned the doctor that didn't like the use of herbs, and you have people that don't want to have anything to do with, the common medications and will only use Eastern practices. And there's benefits from everything, but you have to look at it from the big picture, right? Like, so yeah. So that's why, you mentioned that study that I found and put that in there about, it's better to do those together.
Oh, cool.
I found it. And do those together, they both work, but if you put them together,
you amplify the effect, right?
Right.
Which is fascinating. And that's why everybody needs to put their damn swords down, right? Like, it doesn't matter which medical paradigm is better. What we know for sure is that they are better together, right? They don't make strange bedfellows, right? Like, they are remarkably effective together. I do think that people need to stay in their lanes, right? Like, I'm not out there going and doing surgeries on people and things like that, right? Like, that'd be absolutely insane. I mean, technically acupuncture is like a surgical procedure, but it's like, I'm not gonna go in and like, I don't know, even something that's like a minor surgical procedure, like, I don't know, removing skin tags or something, right? Like, it's not my business, right? Like, I'm going to go ahead and like treat you for your disease with needles, and I'm going to send you to a dermatologist for like the skin tags or whatever else, right? Like, whatever the example is. But like, this idea of integrating, hey, that's the way forward. That is absolutely the way forward. And, I think I saw a question over here that was really fantastic, because it gets to your question, Anissa, about like, okay, yeah, here we go. Julie's question, herbs, right? So in something like, wind stroke, right? That's like a wind stroke would be basically like a stroke, right? We have a formula called Tianma Goteng Yin, which is gastrodia, and gastrodia is this like I mean, sometimes it's hard for me to kind of go back and forth between English, Latin, and Chinese as I start to talk about them. But the other is uncaria, which is this like kind of like, I think it's this like hook shaped kind of vine thing. But anyways, these herbs have these, we know exactly what's in them in terms of like, you know, what are the chemical constituents of them and things like this. Like we know exactly what is in these herbs. They've been well studied. Most pharmaceuticals are actually refined from them in some fashion or other. So it's like, these are really, really not necessarily from those two herbs, by the way, right? Like I'm not saying most pharmaceuticals come from those two herbs, like thousands and thousands and thousands of herbs that are out there. So Tianma Goteng Yin, it was basically written or conceived in like the 1950s, possibly as early as the 1930s, but like kind of hit the mainstream in China around the 1950s. And the physicians that crafted it, they didn't view Chinese medicine as an addendum to Western medicine. They were looking at Western medicine and they were like, man, these guys are going to complete what we're doing. We thought we were complete, but look at they could take pictures of your bones, right? Like they thought this was incredible stuff. And they saw Western medicine as the next step in Chinese medicine, not Chinese medicine as like something that gets added to Western medicine. Again, just like a worldview sort of phenomena here of like how they saw these things differently. But they looked at like what they were seeing with stroke victims and they were like, here's a formula for it. And it turns out that Tianma Goteng Yin is really, really exquisite for it. But this is because Tianma Goteng Yin, through the lens of Chinese medicine, treats liver wind. So this idea, again, of Parkinson's always being associated with a liver wind pathology of some variety, like Tianma Goteng Yin is like kind of a formula that goes right to that. But then you've got these formulas that tonify what we would call liver blood, and we would utilize those. So the herbal formula that you would utilize in the treatment of your Parkinson's would be predicated on your specific set of signs and symptoms. We generally don't like the idea of taking herbs for long, right? Like we view disease in Chinese medicine as transitory, right? A pillar of the medicine is the idea that all disease can be cured, right? You're not supposed to use the C word in medicine. You can't say cure, but the traditions of the medicine in China are that it's transitory. It's not a permanent thing. And so, and I like that, right? I like the idea that it's okay that you can heal from whatever you have going on. I don't like the bleak view of like, oh, you're going to always have this, right? I think that's terrible. Why on earth are we spending billions and billions of dollars as a society to try to find cures for medicine if you're just going to have this thing all your life, right? It's absurd, right? So of course there's this innate idea in all of us that you can be healed from a thing. And herbs are an important part of that, but they would be predicated on your signs and symptoms. So, Julie, I hope I answered your question there.
Well, and there's been some questions that come in specifically about, how does one find a practitioner like yourself, a doctor of Oriental medicine, that isn't, a charlatan, I think is what you said earlier. Is there any hope that this will be ever a part of insurance or Medicare coverage?
Oh man, what a great question. Okay, so I got really excited about the part of like, is it a thing that's going to be covered by Medicare, right? But there was a portion of, I want to answer that, but there was a portion of your question just before it that I got sidetracked by the dangly object, the shiny object of Medicare here. But like, what was the first part of your question?
How do people find?
Oh yeah, okay, so important. So the NCCAOM, which is the National Certification Commission on Acupuncture and Oriental Medicine, maintains a list of everyone that is a diplomate of either Oriental medicine. So I'm a diplomate of Oriental medicine. So when I took my boards, it's a 4 boards module, right? One is like the foundations of Chinese medicine, then an acupuncture module, then an herbs module, and then a basically like a Western sort of conventional care model, right? Like how do you understand disease states through a Western paradigm? And so a Oriental medicine diplomate will have all 4 of those exams. An acupuncture diplomate will have three of the 4. They won't have the herbs component. An herbal diplomate will have also 3 of the 4. They usually won't have the acupuncture component. So the NCCAOM I mean, I think they've been going for 20, 25 years, something like that now. And they have established a really, really good program on ensuring that your provider knows what the hell they're doing. And those boards are difficult. They're very, very hard to pass, as they should be, right? And so the standard that the NCCAOM has set is extraordinarily good. And they maintain a database of all diplomates. And in most states, I think all but 3 at this point, you have to be a diplomate at the appropriate level of medicine. So here in New Mexico, you have to be a diplomate of Oriental Medicine. You have to have all 4 modules done in order to license. So your healthcare professional, if they are not a licensed acupuncturist or Oriental medicine practitioner, and frankly, if they're not a licensed herbalist, I probably wouldn't go to them, because there are herb drug interactions. So here's like a really common one. Gansao is the herb licorice root. And you've got various varieties of this. You got Jurgansao, which is like baked, honey baked licorice root. And there's something that sort of happens when you bake the herb or cook it like that. You denature certain aspects of it that could be toxic. But Gansao in any form contains high quantities of glyceric acid and glycyrrhizin, both of which are substances that will cause you to lose potassium. So if you are on an antihypertensive or an antiarrhythmic drug, such as like digoxin or flecainide or something like that, Gansao could be extraordinarily dangerous for you. I Dr. Housed the heck out of something a little while ago where I had a patient who, for like 30 years, she'd had this, basically like palpitations. And for 15 of those years, she'd had an identifiable arrhythmia. And nobody could figure this thing out. And I was treating her for that, but I ended up working on all these other things that she had going on. And eventually she ends up with basically an infection. And she's like, I'm not taking any pharmaceuticals. Can you make me an herbal formula that will take care of this? I said, I can try, but you can't have Gansao because of, these factors. And she mentioned to me that, oh, well, that's interesting. Why can't I have Gansao? I was like, well, because it contains glyceric acid and glycyrrhizin. And so I found a different herb to use. And out of curiosity, she asked me, well, what is it? And I said, it's licorice root. She said, I'll be darned. 30 years ago, I started sweetening my morning tea with licorice root, and I hate tea, and I transitioned to it because I couldn't have my coffee because my cardiologist said, hey, to get your blood pressure down, why don't you come off of coffee? And so here she was dosing at about 1 gram a day, this substance that was causing her to lose potassium and caused her arrhythmia. So, I mean, it was like fascinating, right? And it's like, well, why, I asked her, why did you do this? And she was like, well, nobody told me it was bad. It's like, well, okay, that makes sense. So now I often end up asking my patients, like, did any hipster at, GNC or Vitamin Cottage or something like that give you medical advice? If so, what are you taking? Because there are these herb drug interactions that are really dangerous. And we need to be able to help kind of observe that for people. So if your herbalist is not a licensed herbalist, or doesn't have a diplomate from the NCCAOM, I'd be pretty leery about going to them, and I would really want to know what their standard of education was. And if it's good, great, right? If they know what they're doing, great. But if they don't, okay. And how do you tell the difference? The NCCAOM can give you that answer, in my opinion. As far as Medicare, so actually next month, the American Society of Acupuncturists is doing a fly-in to Washington, D.C. I'm going, and we're going to be talking to our congresspersons about the need for Medicare to cover acupuncture, and specifically to cover acupuncturists, right? Because Medicare does cover acupuncture for low back pain, but they don't allow an acupuncturist to do the work. And it's like your MD doesn't really have the time, right? And so if I'm going to cover a patient on Medicare, there's this kind of like disconnect between, I have to have the pre-authorization from an MD. They have to, in essence, be supervising the work, and they don't know anything about acupuncture. It's like, why are they supervising it? They're not going to put their license on the line for it. Now they'll send the referral out, and they do trust me to do the work properly. But it's this big problem. It's this massive disconnect between what people thought was happening with the ability to get acupuncture through Medicare and the reality of being able to provide it. So, but I do think, and it's a bill, it's titled Acupuncture for Our Seniors Act. And I would urge you, if you have the opportunity, write your congressman or congresswoman, go check out this bill and see if you can lend your support to it, because it will make acupuncture much more accessible to all Americans.
I'm so glad you shared that. We have had a couple of people asking if they could connect with you about this advocacy. So would you be willing for me to share your email, or you would like me to share theirs with you? Or because I think
go
you're
ahead.
Gonna have some people helping to advocate for you.
Yeah, absolutely. Go ahead and share my email address, and I will do my best either to answer the question myself or plug you in with somebody who can answer it on the advocacy aspects maybe better than I can. There's a lot of advocacy work for us to do in Parkinson's, right? Like let's look at we know that Parkinson's and the pharmacological interventions for Parkinson's affect women differently than they affect men. And last year I talked about the explosion that's coming in Parkinson's because of the high incidence of brain injuries during the wars in Iraq and Afghanistan. But you know what? The most difficult case of Parkinson's that I treat or have treated, and it's the one that I've been the least successful with, was from a toxic exposure. Interestingly, it was a toxic exposure to pharmaceuticals. But the toxic exposures coming out of the wars in Iraq and Afghanistan with burn pits and things like this, we're going to see this massive explosion in Parkinson's just predicated on that. And it's going to affect our female veterans, our female warriors. It's going to affect them much differently than it does our men. And so the advocacy work that we have to do right now, like things like the Michael J. Fox Foundation and things like this, PMD Alliance, right? This advocacy work, it is the reason that Parkinson's is so well researched and so well understood. But we have our work cut out for us. It's not that other people kick the door down. It's like they did, and now we got to go in. We got to go do this work, right? The torch has been passed, and it's time for us to go work.
Awesome. Well, thank you. You brought up a lot of really important things today, not just, the way and the why of using Chinese medicine, but just how it is part of the whole system of care. And, PMD Alliance has our care and support ecosystem, and we look at everything as an entire system. And this is part of that. This is another piece of that puzzle of really, looking at everything that you can do to improve the way you feel, your quality of life, and not siloing everything, but actually bringing it all together. So I want to thank you so much, Dr. Bibeau, sharing all this. We could probably talk a whole nother hour, and some of the very nitty gritty questions that we've gotten that are, very specific to symptoms that I'm sure you would love to delve into if we have more time. We'll just have to bring it back. Maybe let's do this again, just on certain subjects. But today's been wonderful, and you did bring up another point that I'll just state before we close, is that, there's always the potential for side effects like you were talking about in licorice root. And that's why it's so important, like you said, to have someone who is a true practitioner that is credentialed appropriately, and that you also share with your physicians, all of them, what you're taking. Just because you might see someone like Dr. Bibeau for Parkinson's, if you're not also bringing up, any cardiac issues or any of those other things, and you're taking medications for those, well, they all play a role in the chemistry that could interact. So it's important to look at this as the big picture.
100%. So thank you guys so much for having me. It looks like we got to close. I really could talk to you for hours more. Like I really enjoy working with you guys so much. It's a lot of fun. It's passionate for me because I know some of the Marines that I fought in Iraq with there's 100% chance that one of them will develop Parkinson's. And I have a huge risk of it myself as a brain injury victim from an IED attack, right? So it's like, let alone all the medications I was on and the toxic exposures and everything else, right? So it's like, this is personal. And I really love getting a chance to work with you guys and talk to you. So thank you so much for that. I have to say, I saw Julie's comment over here. Best presentation you've ever seen. Pretty cool, right? but that's because PMD Alliance does such a good job getting these things set up. And thank you all. There was one other quote or a question over here asking if you could come with us to DC. I actually don't know the answer to that. But I posted the link that, if you want to kind of take a look at it and see if there's a way to get involved, there's an opportunity. You'd probably be able to find some information there. So thank you.
Well, I see a lot of people have their videos on, but if you don't have your video on and you're willing, if you would turn it on, we have to thank Dr. Bibeau for such a fantastic presentation with our wave of gratitude. So thank you, Dr. Bibeau.
Thank you all.
We do send you the wave of gratitude for today's presentation, and thank you everyone for joining. If you want to save your chat, because we did drop those articles in there and some other resources, just go over to the little dots at the bottom of your chat box, pop that up, and that will give you the option to save chat. Thank you so much everyone for joining us. Take care.